Hello again, and welcome to PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis.
I'm Lita.
I'm Ron.
And I'm Jean Marie.
Collectively, we're the hosts of PodcastDX.
And on today's show, we're talking about the deadly disease pertussis, commonly referred to or known as a whooping cough. I'm sure most people have heard of that.
Yes, whooping cough is a highly infectious upper respiratory disease caused by the Bordetella pertussis bacterium. It spreads easily through coughing, sneezing, or close contact with an infected person. Nothing to do with your clothing. And it can be especially dangerous for infants and people with weakened immune systems.
And let's start with a little background. Whooping cough has been around for centuries, but it wasn't until the early 20th centuries that scientists discovered the bacteria responsible for the illness. And before vaccines, outbreaks were common and deadly, especially among young children and infants.
So the introduction of the pertussis vaccine in the 1940s drastically reduced the number of cases worldwide. But unfortunately, the disease has not disappeared, and in recent years, we've seen an increase in cases due to waning immunity and lower vaccination rates.
Is that one of the ones that you were saying you should get a booster if you had it when you were a kid?
Yeah.
Okay. Well, according to the World Health Organization, there were approximately 151,000 cases of whooping cough worldwide in 2018. In the United States, cases fluctuate each year, but thousands are still reported annually.
Yeah, and unfortunately, there's many experts out there that believe that the real number may be much higher, but people are underreporting or they're being misdiagnosed, especially in adults, where symptoms can be milder and maybe resemble a lingering cold or bronchitis.
And whooping cough usually starts with cold-like symptoms, a runny nose, a low-grade fever, a mild cough, and sometimes sneezing. And this is known as
Catarrh.
the catarrh stage.
Then it progresses to the paroxysmal stage, which includes severe uncontrollable coughing fits. These fits can end in a high-pitched whoop sound as the person gasps for air, hence the name whooping cough.
I'm glad you two got those big words.
Well, you're going to have a big word coming up.
Okay. So in infants, though, there might not be a whoop at all. Instead, they may stop breathing for short periods. That's called apnea.
Good job.
They might have apnea or even turn blue. They can struggle to eat, sleep, or even breathe adequately.
And that's why it can be deadly.
Mm-hmm.
Yeah. Doctors typically diagnose whooping cough through a nasopharyngeal swab. And while tests for the presence of the Bordetella pertussis, it's actually, which test for the presence of Bordetella pertussis, but it's actually kind of like a finicky test.
Okay.
So that might be another reason why it's underdiagnosed. Blood tests or a chest x-ray may also be used to check for complications such as pneumonia.
And just like everything else, early diagnosis is key because the antibiotics work best when given during the first phase of the illness before the severe coughing starts.
So unlike the common cold, this is a bacteria-based illness, and that's why antibiotics can work and treat it and are vital.
Okay. Well, whooping cough can lead to serious and even life-threatening complications. In infants, these include pneumonia, brain damage, seizures, and even death.
And for children or adults, coughing fits can cause vomiting, exhaustion, rib fractures, and also hernias. It's a brutal illness, and it can take a major toll on somebody's body.
And treatment, as we said, usually involves antibiotics to kill the bacteria and reduce the risk of spreading it to others. However, once the intense coughing phase starts, antibiotics don't usually shorten the illness. They just help prevent transmission. And I would think that they would also help curb, prevent, pneumonia and other progressive illnesses.
Well, supportive care is also important, like rest, fluids, humidified air, and staying away from irritants like smoke. And in severe cases, especially in infants, hospitalization may be required.
Well, the good news is that whooping cough is preventable thanks to vaccinations. There are three main vaccine types, if I'm pronouncing these right, DTaP, Tdap, and the older DTP
Yeah.
Yep.
vaccines.
Yep.
Excellent.
DTaP is typically given to infants and young children, and the schedule usually starts at 6 weeks of age with additional doses and you need all three. It's actually sometimes referred to as a DTaP 3. So you need it at 6 weeks of age, 10 weeks of age, 14 weeks, and then a booster at 2 years. And this is some can be off by a couple of weeks, so make sure you consult your child's healthcare provider.
Okay. And Tdap is the booster shot that's given to preteens, teens, and adults, and to pregnant women during each pregnancy, typically between 27 and 36 weeks. That maternal dose helps protect newborns in the first few months of life before they are fully vaccinated.
That sounds like a really good idea.
Yeah.
So in many parts of the world where infant mortality from pertussis is high, maternal vaccination with DTP can help extend passive immunity to the baby during the most vulnerable early weeks of life.
And vaccination really here, it's your best defense. But there are additional steps that you can take to help reduce the spread of whooping cough and other bacterial diseases.
Well, that includes frequent hand washing, wearing a mask in crowded places, especially during respiratory illness season, and keeping infants away from people who are sick or have recently been exposed to illness. You know, back in the day, we weren't allowed to have our baby visited by anybody until they were, I think it was a month old.
Well, it's probably a good idea. And you might have contracted the illness, but not yet be exhibiting symptoms right away. So,
and everybody wants to kiss a baby.
And I would say
no kissing
no
the
kissing.
baby.
You can kiss the baby, later.
So all you politicians out there, no kissing.
That's
oh,
right.
God, yeah, absolutely not.
So anyone with an upper respiratory infection or who has been exposed to one should avoid close contact with babies, like we're talking about, for at least 8 weeks. And that's how long the bacteria can potentially stick around in someone's body.
That's a long time, yeah.
It is a long time. Okay, not 1 month, 2 months.
2 months. And looking ahead, researchers are working on a new vaccine, and it provides longer-lasting immunity. There's also growing interest in improving awareness among adults, since adult cases often are underdiagnosed and pose a serious threat to infants and those with compromised immune systems.
We've come a long way since the days when whooping cough was a leading cause of childhood death, but the battle is not over. Staying current with vaccines and being cautious when you're sick can save lives, especially the lives of our youngest and most vulnerable.
And that wraps up this episode. And this is a reminder that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast.
Thanks for joining us for this episode of PodcastDX.
Stay informed, stay vaccinated, and stay healthy.
Thanks for listening. We'll talk to you again next week.